Denying ventilators to COVID-19 patients with prior DNR orders is unethical, is an article published by Koch and Hahn to which discusses the ethical dilemma faced when physicians and medical staff are forced to define resource allocation policies pertaining to ventilator use in pandemic situations. Policies have already been set in place to help physicians determine allocation of resources in pandemic situations. Many of these include a three-step process of application of exclusion criteria, assessment of mortality risk, and periodical clinical assessments. In many states, in the exclusion criteria process, a known previous or current DNR status is included in the exclusion. Therefore, if one has had a previous or current DNR on file, they meet criteria for being denied a ventilator in dire situations. The bioethical dilemma presented here is the patient's respect for autonomy is being threatened. According to Bowenchap and Childress, autonomy is described as a capacity in which an individual is able to make decisions for themselves, especially in relation to their health. In this case, the individual is denied their choice and voice in care because of a previous or existing DNR order. Further, a DNR order does not define the needs of care, rather only defines the patient's wishes regarding CPR. Therefore, denying a ventilator based off a DNR order is denying the patient of a life-saving treatment. This issue is imperative to discuss because it denies the patient the right to take an active role in their care. Further, this topic proves that policies in healthcare regarding dire situations need to be reevaluated on a consistent basis to ensure patient autonomy is upheld. In relation to the Code of Ethics for Nurses, the denial of treatment challenges Provision 3. The nurse promotes, advocates for, and protects the rights, health, and safety of patients. This ethical dilemma encourages nurses to step in, advocate for the care of their patients.